Hi, my name is Dr. Lena Edwards. I'm a practicing internist who is also board certified and fellowship trained in functional integrative medicine as well as integrative cancer therapy. You've chosen to watch this YouTube video because you are also intrigued and wondering about the terminology of adrenal fatigue. What is adrenal fatigue? Adrenal fatigue is a term that has been used to describe a condition whereby the adrenal glands become exhausted after being exposed to situations of chronic stress. After exposure to chronic stress, the adrenal glands then lose their ability to produce adequate amounts of cortisol to produce an additional fight or flight response in the face of recurrent or additional acute stress. Well, the good news is, indeed, there are states of low cortisol, the hormone that is primarily involved in the fight or flight response and the reduction of that hormone that is usually used to describe adrenal fatigue, low cortisol. So the good news is, if you suffer from chronic fatigue, if you suffer from chronic pain syndromes, if you suffer from stress sensitivity, then you indeed may have low cortisol. And it is something that the medical research has shown does exist and can wreak havoc in someone's life. However, the medical research also does not confirm the fact that the low cortisol states that you may be experiencing come from something called adrenal fatigue. You see, the terminology implies that the entire universe of the stress response system lies within the adrenal glands. This is completely inaccurate. The adrenal glands are just one organ out of several other organ systems that are involved in the human body stress response system. Add to that the influence of your immune system, neurotransmitters, amino acids, your personality, your upbringing, the life that you had when you were a child, the environment when your mother was pregnant with you. All of those things influence your body's stress response system, how well it functions, how well it adapts, and how easily it becomes diseased. So let's look at the difference between the concept of adrenal fatigue and the more adequate and accurate medical terminology known as hypocortisolism, which basically means low cortisol. Low cortisol states do indeed arise, and if you look at the medical literature, and there are thousands of studies that have been done over the last almost 200 years, basically, the state of low cortisol arises primarily because of a disconnect between the brain's message to the adrenal glands to produce cortisol and then the adrenal glands' ability to produce cortisol in response to that message. Perhaps the message is given, but the adrenal glands don't hear it. Perhaps the brain delivers the message. The adrenal glands listen to that message, they produce cortisol, and then the brain becomes concerned that too much cortisol will destroy the human body, and so it turns down the signal, and the signal never gets turned back on. During illness, there's something called the sickness response, whereby your body's immune system will be upregulated to help defend you against an infection. And by doing so, cortisol is suppressed, because cortisol, of course, is the hormone that suppresses your immune system, prevents your immune system from attacking yourself. And so for that reason, sometimes when people are ill, their cortisol levels will purposely stay low so that their immune systems can go up. Those of you that have ever taken prednisone for an autoimmune disease or other type of infectious disease or inflammatory disease know exactly how this process works. So basically, my whole mission in providing you with this information is to let you know that adrenal fatigue as a true entity does not exist, nor has the medical literature ever shown it to exist. This is important because if you look at all of the major medical organizations in this country, they all belittle and scoff at the whole concept of adrenal fatigue. And that's going to serve as a huge barrier to you when you try to go work with a physician and trying to identify your low cortisol states and label yourself as having a condition that doesn't even exist. Again, it's very important for you to realize that is not to say that you do not have issues with low cortisol. And it's very easy to identify by doing a four-timed 4-day salivary cortisol test, which will tell you the pattern of cortisol release as well as the amount. Very important, and literature continues to emerge to show how these details are extremely important in not only how people feel on a day-to-day basis, but what types of diseases can develop in the future if that condition is not corrected. But again, rarely does that situation arise because the adrenal glands single-handedly and independently decide they're going to quit making cortisol. Why does low cortisol arise? Many different reasons. Perhaps you're missing a vitamin that the adrenal glands need to produce cortisol. Perhaps you're missing a hormone that the adrenal glands need to produce cortisol, such as cholesterol. All of you patients who take statin drugs may want to keep that in mind. Perhaps you've had stress for such a long period of time that the ability of your brain to communicate properly with your adrenals to tell them to make cortisol has been improperly handled or is damaged, and that communication system is no longer in place. There are far more complicated reasons why low cortisol arises. However, wouldn't it be depressing to know that if it were truly just your adrenal glands and they had decided to give up, that there would be no hope for you? There would be no hope for treatment. In fact, proponents of the terminology adrenal fatigue will put in their writing that most people with adrenal fatigue never recover. Boy, that would be a very depressing way to live, and it's completely inaccurate. I have taken care of thousands of people with low cortisol and adrenal dysfunction, perhaps. And all of those people are correctable if you know where to look, if you identify the cause and you treat the cause. To mislabel everything that's fatigue, to mislabel everything that's low cortisol as adrenal fatigue does a disservice not only to you as the patient, but also to your physician, who will be unable to help you, who will be unable to properly diagnose and treat you because you've been labeled with a term that is inaccurate and short-sighted. If you wish to get more information on this topic and to truly get a better understanding of how adrenal fatigue is inappropriate terminology and how terminology will make a huge difference in whether or not you get the proper treatment, please look at very reputable websites on the internet. You can also look at my website, balancehealthandwellnesscenter.com, and I've also written a book on this topic. It's called Adrenalogic: Outsmarting Stress, and the website for that is www.adrenalogic.com. I do lots of blog writing as well. Easy Articles also has several of my articles. All of my writing and my speaking and my teaching on stress and stress-related disease is evidence-based, not only on medical literature that has been done, but also on my practical clinical experiences that I deal with on a daily basis as a practicing physician. It's very important that you know where you're getting your information from, the credibility of the information that you're receiving, and then you use your brain, your insight, your education to make the best decision for yourself. Thank you for joining me, and I look forward to providing you with other educational videos in the short term.